ఆ?
ఓకే అంతే.
Good afternoon to one and all. Welcome you all to the fourth day of our one-week National Online Faculty Development Program on Sustainable Innovations in Drug Delivery, a multidisciplinary perspective organized by the Department of Pharmaceutics and Biotechnology in association with the Indian Pharmaceutical Association, Siddhartha Nagar branch, organized at Kvsrscops College of Pharmaceutical Sciences, Vijayawada, virtually. I am Dr. Sheikh Arifa Begum, the organizing secretary of this FDP, and it's my honor to extend a warm welcome to all our distinguished participants, respected resource persons, and faculty members who have been consistently engaging in this academic journey over the past 3 days. We thank each one of you for your continued participation, enthusiasm, and active engagement throughout this week-long event. This program is designed to foster collaborative learning, and share interdisciplinary knowledge on innovative and sustainable approaches in drug delivery, a subject that continues to evolve and redefine the future of pharmaceutical sciences. Moving forward with today's academic schedule, we are honored to welcome our esteemed speaker of the day, Dr. Anand Kumar Chettipalli, Sir, Professor, Department of Pharmacy, Galgottias University, Noida, Uttar Pradesh. We are privileged to have their presence with us today. Now it's my pleasure to hand over the virtual mic to our moderator, Dr. N. Kanakadurga Devi, Madam, Professor, Department of Pharmaceutics and Biotechnology, to begin today's proceedings and steer us through a day filled with sharing, knowledge sharing, and insightful dialogue. Over to you, Dr. N. Kanakadurga Devi, ma'am.
Good afternoon to one and all. Now it's my immense pleasure to introduce esteemed resource person for today's session, Dr. Anand Kumar Chettipalli, sir, is Department of Pharmacy, Galgottias University. His unwavering commitment, dedication, and passion for his profession set him apart as an exceptional individual. Dr. Chettipalli, sir, earned his M.Pharm from Acharya Nagarjuna University and his doctorate from Sri JJT University, Rajasthan. During his postgraduate studies, he secured central government funding from AICTE. With extensive research experience, Dr. Chettipalli sir has built a notable record of publications including articles in Web of Science and Scopus Index journals with a total of 800 citations, an H index of 15 and an I-10 index of 20. He is recognized as a research supervisor at Galgottias University and Anurag University. His research portfolio includes over 55 publications, 8 books, 10 Indian patents, 2 Australian grants, and 1 German patent granted. Currently, Dr. Chettipalli sir supervises 8 completed PhD scholars and 6 more that are pursuing their PhDs in areas such as drug delivery systems, elastic vesicular carriers, polyherbal formulations, nanostructured lipid carriers, biosomes, and spalastics. He also guided approximately 65 master students through their dissertations. In addition to his research and academic duties, Dr. Chettipalli sir has organized numerous national and international conferences, workshops, and faculty development programs. He also delivered lectures at various national and international conferences and FDPs. He is a member of PCI inspectors and holds life membership with professional board bodies including IPS, APP, IPA, APTA, and the Hong Kong CBEE Society. He also served as a member of the Institutional Ethical Committee at Global Hospitals. Notably, he was invited as a resource person to Bulgaria in 2019 for the ICNPU International Conference. With this brief introductory profile, now I invite Dr. Anand Kumar sir to take over the session. Over to sir.
Thank you, ma'am. Thank you very much. So, may I audible, all of you?
Sir, communicate, sir.
Yeah, audible, Anand sir.
Yes, sir. Thank you. Thank you very much. Yeah, good afternoon to all. Today, my topic is the design and fabrication of novel nano carriers for brain targeting via intranasal route for pain management of drugs. So this is the topic. Today I am giving the lecture. So coming to this, so first I will ask one question all of you. What are the past participants are here? What if you could treat the chronic pain by simply inhaling your medication? See here, I am giving one complete picture. The patient perception and each and every patient perception is different for the pain. The pain does not maintain or does not equally distributed in patient to patient. Each and every patient variants are different. Because of these reason, we can't measure the pain and we can't try to reduce the pain in sometimes. So we have the different type of statistics we are applying on the pain. If you could treat the chronic pain by simply we can inhale our medications. So that's why the intranasal nanocarrier based drug delivery system is very, very important in nowadays. So coming to next, these all are my session outline. Introduction to pain management and CNS drug delivery system, intranasal route for brain targeting, nanocarriers in brain drug delivery, design and fabrication approaches, and characterization techniques, and case studies and recent advances, and challenges and future directions. So before introduction, I will give the total outcome of my study, the learning outcomes. Is it visible, all of you?
Yes, sir.
Yeah, thank you. My PPT is visible?
Yes, sir, it's visible, sir. Learning outcome 1 and learning outcome 2.
Yeah, thank you. Thank you very much. So out of these complete session, we need to learn two things here. Understand the principles and rationale behind using of intranasal drug delivery system. That is the first learning outcome. And second one is the demonstrate knowledge of the formulation and characterization of novel carrier. Today, interestingly, I am giving one more new recent novel carrier. We'll discuss about these the later slides. So coming to the pain management. In the pain management, we are using IASP. The IASP means the International Association of the Study of Pain. The first pain, the IASP is given the term that is the unpleasant sensory and emotional expressions associated with actual or potential tissue damage. The pain means the IASP is given the statement of the pain, the unpleasant sensory and emotional experience. The pain is completely emotional. It is a psychological experience or either physiological experience. It is a mixture of complex, either physiological and psychological, the both mixed together, that is called as a pain. So that's why the IASP, International Association of Study of Pain, is given by 2020 is the definition. unpleasant sensory and emotional experience associated with actual and potential tissue damage. So we have so many pains are there. Notably, I can write almost 6 pains: nociceptive pain, neuropathic pain, inflammatory pain, and central pain, chronic pain, and breakthrough pain. So these all pains are there in a different parts of the body, and all are associated with peripheral nervous system and central nervous system. It is caused by tissue injury, or it is caused by nerve damage, or it is caused by inflammatory responses. It is infection or disinfection in the brain or spinal cord and persist for greater than 3 months. So here we can classify in two types of pain. One is acute pain and second one is chronic pain. The acute pain, it is also new onset, and chronic pain, it is 3 months or more than 3 months. So out of these all 6 pains, only we can identify the prospective of pain and burns and fractures, diabetic neuropathy, spinal cord, rheumatoid arthritis, and stroke related pain and chronic back pain, and common in cancer patients. The cancer patients after third stage, the majority of the people are suffered as the breakthrough the pain. That is sudden transient flare in baseline, the chronic pain. So these descriptions we can identify in a different pains, how the nano carriers are major treated for these type of pains we can see later. So coming to, I can take so many statistics in a different country. The National Institute of Health and National Center for Complementary and Integrative Health, the pain in the US, 25.3 million American adults suffer from daily pain. And 23.4 million American adults report a lot of pain. I will tell you one more example for the migraine. Out of 4 people in America, in US, out of 4 people, 3 members are suffered from migraine. The so many oral tablets are there, so many injections are there, inhalers also there, but it is not treated properly. So because of these statistics and global prospective pain management, market in 2022, the persistence market research, the given the 2022 to 2031, the North America, and by region, the North America almost 46.1% they suffered as a pain. And next place, the East Asia, next place, MEA, next place, Latin America, and then Europe, then South Asia, and then Oceania. And all are using these pain, the North America, by different type of drugs classes. The commonly they are using opioids or NSAIDs or local anesthetics or acetaminophen. So these depends on the statistics. We can identify which one is suitable for the intranasal drug delivery system. What novel carriers, either not in an intranasal drug delivery, either oral drug delivery, or either topical drug delivery, or either parenteral drug delivery. The depends on these statistics. We can go for the intranasal drug delivery. It is the best choice for the treatment of the CNS disorders. So here I can clarify the different type of diseases, the arthritis and neuropathy and malignancy, muscular and post-traumatic or post-surgical pains are available. These all are the different type of statistics in worldwide. So depends on these statistics, we can choose which type of drugs are suitable for the treatment of intranasal drug delivery, what are the limitations are required, and what are the advantages are better when compared to the oral route of administration. In nowadays, when compared to the oral route of administration and parenteral route of administration, the nasal route of administration is best choice for the treatment of CNS disorders. I will prove it coming to my slides, and whenever I will give the statement, it is the best choice. That choice I can tell you very clearly. So, what are the challenges in CNS targeted drug delivery system? The first challenge is the central nervous system is protected by the blood-brain barrier. So previously, I think before session, the complete blood-brain barrier they can clearly explain. So highly selective and restrict to physiological barrier. While this protects the brain from toxins. So always the blood-brain barrier, it is comes bloodstream and extracellular space, and it is supplied in oxygen and nutrients in the brain, and physiological between the brain and blood, and what is the pathogens and harmful metabolites are large hydrophilic molecules, and diffuses some of the time it will diffuses as oxygen and carbon dioxide and hormones and small non-polar molecules, and transport glucose to the brain. So these all the small molecules, or it also blocks 98% of small molecules of the drugs and nearly 100% of biologics. So these are the different type of barriers for challenging for the treating of CNS targeted drug delivery system. The first one is blood-brain barrier. It limitations the penetration of hydrophilic and large molecular weights and affects transporter, the actively remove of drugs from the CNS. The here PGP glycoproteins and breast cancer receptor proteins. The both are equally influence the efflux transporter and enzymatic degradation. So those peptides and proteins are broken down before reaching the brain. And limited bioavailability, many CNS drugs have poor solubility or rapidly metabolized and invasive route, that is intrathecal. It is very risky and painful and not suitable for the chronic administration. So here the CNS drug delivery systems is the majorly is a chronic pain. So that's why these all challenges we need to overcome, and then we can go for the good nano carrier for the intranasal drug delivery systems. So that's why we need to enhance or the different type of. So here I given one YouTube link. You can check it. What is the strategies and what are the challenges of the CNS targeted drug delivery systems. So coming to the CNS tumors, and what are the drug delivery challenges, and what are the drug delivery applications or approaches and drug delivery materials and innovations. So these all CNS tumor or CNS related. So we require the physiological or anatomical location, and what is the importance of biological barrier, and what is the heterogeneous in nature and unique microenvironment. So based on these treatment challenges, so how we need to overcome the blood-brain barrier and how the drug is penetrating to the brain, how it will cross in a through the nasal route, and how it will reaches to the systemic circulation. So here these all are the different type of drug delivery challenges we need to overcome in a particular things or particular mechanisms. So commonly we are using their active transport or passive transport or diffusion transport. So depends on the mechanism or depends on the system, we can identify which approach is suitable. Are you understood, all of you?
Yes, sir. Sir, the slide is not moving. Whether it is you have shared the slides, sir. We are it is showing as a learning outcome 1 and 2. That's it. Yes, sir. Now the pictorial representation can be seen. CNS tumor.
Now it is changed or same slide only it is showing?
No, sir. It's changed. It's showing the pictorial representation, sir. CNS tumor.
Okay, next I will change the slide and then it is showing or not?
No. Yes, sir. Why intranasal nanocarriers?
Yes, okay, thank you.
Okay.
So coming to this, the drug delivery system, we have a different routes of administration, that is a local route and conventional enhanced delivery and intranasal delivery and intrathecal delivery or systematic approach or either local approach. So it depends on these delivery systems, either local or systematic. And drug delivery materials or innovations, or sometimes we need to use the nanomaterial based strategies and biocompatible strategies and integrated delivery systems and biomimetic and common fluid materials. So these all depends on the excipients. So how the drug is entrapped with the excipient and what type of route, what is the change of the system. So we can identify in these all delivery systems, it is a major penetrating power or major enhancing of the solubility and bioavailability. So here, and depends on the system, why we need to take as the intranasal nanocarriers. The major advantage of intranasal nanocarriers, direct nose to brain transport via the two pathways are there, that is olfactory pathway and second one is trigeminal pathways. And whenever we can give these type of pathway, it will minimize the systematic exposure and reduce the dose. So here I will tell you one more example for the systematic approach. Dihydrocargotamine. Yes, dihydroergotamine. Whenever we can take the dihydroergotamine, the actual dose of our marketed dose of the drug is 4 mg. But whenever we can add the beta cyclodextrin, then automatically we can enhance up to 10 mg per ml. Sometimes we need to reduce, if the dose is 100 mg, then we can reduce 10 mg. So then the third advantage why we need to choose as intranasal nanocarrier to enhance the brain bioavailability of poorly soluble or unstable drugs. So coming to this, which type of drugs are suitable for the intranasal drug delivery systems? And which type of drugs are suitable? And those drugs are local delivery systems like antibodies, commonly we are using. And then here we can identify low molecular weight, less than 500 Daltons molecular weight. That type of drugs are suitable. So coming to this intranasal delivery mechanism, what is the mechanism of the intranasal drug delivery? The two different pathways are there. Before mechanism, I will tell you what is the anatomy of intranasal drug delivery. So here the 5 different parts are available in the down image. The first part is vestibule and second one is arterium and third one is the turbinates. These turbinates are 3 different types. One is inferior turbinate and second one is middle turbinate and third one is superior turbinate. And fourth one is olfactory epithelium and fifth one is nasopharynx. So these all 5 parts are there. The vestibule, it is the frontmost part of the nasal cavity. It has a limited absorption, not a primary absorption site, vestibule. And second one is arterium, the transitional zone between the third one and first one. The third one is a turbinate and first one is vestibulate. This is the translational zone. It is a minor role in the drug absorption. It is not a particular proper site for the drug absorbing position. And third one is turbinates. It is a bone structure or bone is structured covered with respiratory epithelial cells and the surface area is high and rich in blood vessels and responsible for the systemic circulation. So coming these, the is a major part, but it is a minor pathway of the transfer of intranasal drug delivery. And coming to fourth one, the olfactory epithelium. The olfactory epithelium is the roof of nasal cavity and above the superior turbinates, and then it contains olfactory sensory neurons and connected to the olfactory bulb. So coming to second picture, you can observe the olfactory bulb and olfactory region is there. That is the major pathway. And if the nasal route, it will goes as a inhalation, then it will goes as a lungs. That is called as a minor pathway. So respiratory region is the minor pathway and major pathway is olfactory pathway or olfactory region. So how the drug goes in a olfactory region to the brain. The olfactory epithelial cells, the root of nasal cavity and above the superior turbinates, it contains olfactory sensory neurons connected to the olfactory bulb, and then it is called as the primary pathway. And finally, we can identify nasopharynx, and it is a posterior part connected to the throat. This is a posterior part connected to the throat. Coming to the nasal cavity, the first image, the nasal cavity is a two different pathways, olfactory pathway and trigeminal pathway. The olfactory pathway is a major pathway and trigeminal pathway is minor pathway. The both are, it will goes as a brain and some it will goes as a bloodstream and then this goes as CSF. They has so many drawbacks for intranasal drug delivery system. These all drawbacks we can overcome in the intranasal drug delivery system. The first one is the nasal epithelial, the alteration of mucosal layer. We required the alteration of mucosal layer. So these alteration of mucosal layer, the number of excipients, the mucous layer, almost the large number of excipients we are using, either non-ionic or cationic excipients, and sometimes we are using as a bile salts also. The bile acid also or bile salts also we are using for the alteration of mucous layer. If the bile salts known to decrease the viscoelasticity and then the permeation is enhances. So these nasal route has the much attention to the non-invasive transport of the drug, and then on the date of these olfactory and trigeminal nerves, it is a safe and effective pathway to deliver the therapeutic agents to the brain. And alternative, it is a feasible alternative for the oral and parenteral route of administration, and it will administered for the some of the drugs to the high permeability in the nasal epithelial cells, and the major advantage for the minimizing of the lag time in a oral drug delivery and offers non-invasiveness, and it is also useful for the patient. The patient compliance is very easy and the self-medication we can take it. So coming to this in a different way for the release rates of intranasal drug delivery, it is not an immediate release. We can maintain as a sustained drug delivery. Then nowadays we are using in situ gels. So coming to the drugs, the in situ gelling system, the liquids we need to maintain as a temperature but undergo the gelation and during in contact with the body fluids. So these are the two different phase systems. The lipophilic drugs are highly suitable for the intranasal drug delivery system. And one more case is there, the lipophilic drugs, those drugs are less than 1 kilodaltons. That type of drugs are suitable for the transcellular route. If the below 500 daltons, that drugs are easily passes either passive diffusion and transport or either receptor mechanisms. So here, the out of these picture, we can involve or crossing of respiratory epithelial by xenobiotics. So always, whenever we can select the drug, what is the physicochemical properties of the drugs? And we can check it as if the less than 1 kilodaltons and then transcellular route, and these are transport as the two different mechanisms, that is endocytosis and transporter. So in the transporter, the organic cations transporters and AAT amino acid transporters. These two transporters we can observe in a different type of lipids or liquids in a inside to gelling system. So what are the advantages and limitations of intranasal administration of the drug for the systematic delivery? The molecular weight below 1K Daltons, it is highly absorbed for lipophilic drugs. Then, if you more than 1 kilodaltons, the poor permeability for hydrophilic drugs and drugs with proteins and peptides. But here, one more chance, the alteration of tight junctions. So in the blood-brain barrier, we have a tight junctions. It is not open. Those molecules are small. Those molecules are below 500 Daltons. That type of molecules only transported through the blood-brain barrier or cross the blood-brain barrier, it will reach us as a brain. But here, the alteration of tight junctions. We have a different type of agents. The one is EDTA and second one is bile salts. The EDTA and bile salts which are able to sequester available in a extracellular fluid, that is cations, which will cause the tight junction to open. If you are adding your drug, either EDTA or either bile salt, then the tight junction complexes are open, then the drug is passes through the brain. And then the second advantage of this intranasal drug delivery, the avoidance of GAT and hepatic first pass metabolism. And these limitation, the absorption time limited, but mucociliary clearance. The enhancement of drug delivery, the reversed micelle formations. If you are taking as a mucociliary nature and low absorption surface area or enzymatic degradations or either non-invasive or self-medication, these are the different type of advantages when we can identify what type of limitations we can overcome, and these all limitations we can overcome because of the reason we have agents. That all agents is useful for reducing of the particle size and enhancement of solubility and increasing the permeability through the nasal cavity. So here we can chronic alterations of the nasal mucosa or stimulations or simultaneous administration of vasoconstrictive drugs also there, and a local intolerance towards nasal mucosa. The all CNS type of disorders, we can take it for intranasal drug delivery systems. So here I can mention the different challenges or more challenges for the nasal drug delivery. These all challenges we need to overcome through the agents or through the large number of excipients, either cationic surfactants or anionic surfactants. These all are depends on the pH, the HLB value, hydrophilic lipophilic balance value depends on the value, then it will more permeate through the nasal cavity. And then coming to this nasal drug delivery system and improves the enhanced absorption and increase the bioavailability. So here the surface area is large. The molecule surface area is large, then solubility is high. If the solubility is high, then absorption is high. If the absorption is high, then bioavailability also high. So we have a different type of the characteristic features or mucoadhesive systems or mucociliary enhancement and co-micelizations. And whenever we can add in a different type of excipients, we can choose it as the micelle formation. We can use phosphatidyl choline, or we can use phosphatidylserine, or we can use and bile salts, or we can use surfactants, or we can use edge activators. These all are the enhancement of the micellization, the formation of micellization. So here nowadays the all chemistry people are doing in a docking, but whenever we can take the all excipients, is it form as a micelles or not? If the group of molecules are attached to the drug, then it is more permeated or entrapped, then the drug is converted to the state. The drug's initial state is different when we are, or when adding of the excipients or large molecules, these all connected to the drug, then the drug is completely entrapped with the particular excipients. So here we can find out the controlled and sustained release systems. The co-administration of different type of excipients. The best example is cyclodextrins. The co-administration of cyclodextrins. Our second one is the phosphatidylcholine, that is a medium chain, the proteins, or long chain molecules are phosphatidylserine and phosphatidylamine, and these all are that depends are connected in the drug and reduce the toxicity and increase the release rate of the system. So these absorption of various proteins and peptides are larger lipophilic and hydrophilic moieties. Why we need to mention is the larger lipophilic and hydrophilic moieties. The hydrophilic moieties are not suitable for the intranasal drug delivery. So here I will given one complete statement. The hydrophilic drugs are not suitable for the intranasal drug delivery, but we need to overcome this problem also. So moving to multiple benefits because of different types of benefits, and we need to identify the erosion of mucosal surface area. So here we need to erosion of mucosal surface area, and then we can reduce the toxicity, and we can certain kind of surface energy is required. So based on that, we can check it as the different commercial products are available in the marketed formulations. Antibiotics and sneezing, and these are different manufacturers, and these are the different type of nasal sprays, nasal gel, nasoclear. Nowadays we are using nasoclear, that is the only solution, but nasoclear gel also there. So these intranasal drug delivery having so many challenges. The first nasal epithelial, we need to alteration of mucosal layer. If you alteration of mucosal layer, the number of excipients or large number of excipients, that is called as anionic surfactants and cationic surfactants or bile salts, we need to enhance. And second one is the alteration of tight junction complex. And third one is erosion of the mucosal surface. And fourth one is enhanced contact time at absorption site. If the drug bioavailability we need to enhance, the contact time between the drug and absorption site increases, then automatically we can avoid these limitations. So these are the commercially available marketed formulations and marketed intranasal drug delivery system for CNS disorders. Only almost 7 or 8 are there. So one is benzodiazepine, that is midazolam, and diazepam, and 5, 10, 15, 20 mg also there. Esketamine, that is 28 mg. Sumatriptan, which is also acute migraine, and then zolmitriptan also there, and sumatriptan also there, and then glucagon, that is severe hypoglycemia, and dihydroergotamine. Previously I told you the dihydroergotamine, whenever we can add the agents, the beta cyclodextrins to dihydroergotamine, the total dose, the common dose we need to enhances. So So are you understood regarding these intranasal drug delivery system? What are the challenges we are facing of intranasal drug delivery? How we need to overcome? Anybody please respond. Are you understood the intranasal drug delivery system and what are the challenges we are facing?
Sir,
You have any queries regarding these intranasal drug delivery system? What are the challenges we are observing for that
no,
intranasal
sir.
drug delivery? Okay, thank you, ma'am. Coming to these novel carriers, the nano carriers in drug delivery, not in brain drug delivery systems. As per my knowledge, 26 novel carriers are there. 26 novel carriers are there. So commonly, the all are doing the liposomes, niosomes, transferosomes, cubosomes, nanoparticles, microparticles, and hydrogels and micelles, microemulsions. So these all novel carrier systems are classified in different ways. That is vesicular system, and then particulate systems, and self-assembled systems, and emulsions and cellular carriers. I am not classifying these all carriers, but I am telling the total novel carriers are 26 as presently. So these all are the different types of the classification of nanocarriers. The classification of nanocarriers depends on the particulate system, depends on the vesicular system, and depends on the miscellaneous. Today I will tell you the new novel carriers. One is the bilosomes and second one is spanelastics. I am targeting on only bilosomes. It is very easy uh, doing of project either MPharm cases. In our laboratory also, in a normal laboratory also, we can do very easy process or easy method. No need to high equipments and no need to do high excipients. Simply we can use the two or three. You can choose not in an intranasal drug delivery, any type of the drug delivery. The bilosomes we can use. And coming to these, we have here so many dendrimers or liposomes, exosomes, invasomes, and then nanomiscellaneous or nanovesicles or polymeric nanoparticles and gold nanoparticles, carbon nanotubes, quantum dots, invasomes. So these all are there. So out of 26 novel carriers, I will tell you today, the one is bilosomes. So nanocarriers helps drugs overcome mucosal barrier via the multiple mechanisms. We have here so many mechanisms are there. We need to overcome the mucosal barrier, the mucoadhesion, paracellular transport, transcellular transport, or endocytosis or exocytosis, and neuronal exploitation or neuronal pathway exploitations. So here, the explanation of these mechanisms, whenever we can identify the nanocarriers, it will help the overcome the barriers, either mucosal or either mucociliary barrier or either nasal barrier or either GAT barrier. These all we can increasing the nasal mucosa or increasing the residence of the time and tight junctions and passive diffusion and epithelial cells and olfactory trigeminal nerves. So these mechanisms for enhancement of drug transport across nasal membrane. What is the role of nanocarriers in improving the drug properties? those drugs are poor solubility, those drugs are low bioavailability, those drugs are enzymatic degradation, those drugs are rapid clearance, those drugs are poor blood-brain barrier penetration. So each and every category and each and every challenge we need to overcome, or we need to identify or improving the property. So nowadays, the solubility enhancement techniques also there. So commonly we are using the solvent or co-solvency system. The best method for the enhancement of solubility, that is a co-solvency system. The two different solvents we can use, then automatically the solubility we can enhance. The nanoemulsions and liposomes improve the solubilization of hydrophobic drugs. And we can take as a prolonged nasal retention or improve the permeation, lead to higher brain drug levels. And then commonly the proteins and peptides, it is a large molecular weight and large carbon chains. So these drugs are easily, we can convert as solid-lipid nanoparticles and polymeric nanoparticles. And mucoadhesive contain the reduce the mucociliary clearance. And intranasal route, the receptor, commonly we are using the different type of receptors, and then finally we can identify it. Then coming to the biolosomes as a novel nanovesicular carriers. So this is the structure of biolosomes. So here the inner side, the green color is the hydrophilic drugs, and outer side the red color is hydrophobic drugs. And both sides we have a micelles are there. Tail and head is there. The all sides we are covered with a non-ionic surfactants. It is also called as conventional niosomes. Commonly, when preparing of niosomes, what we can take? Simply we can take it as the cholesterol. Cholesterol is a lipid, and then surfactant and stabilizer, then ethanol or either methanol. Then we can take it as our preparation of niosomes. But here, the bile salt we are using. What is the importance of the bile salts or non-ionic surfactants? It is alteration of mucosal layer. It is a changes of absorption site, or it will enhance the absorption site of bile salts. The bile salts known to decrease the viscoelasticity and increase the absorption. So that is called as the bilosomes. It is a biphasic system. So in these bilosomes, we are using, one is a lipid. So I will tell you so many examples in lipids: SDC, sodium deoxycholate, sodium phosphatidylcholine, sodium phosphatidylamine, soya lecithin, and cholesterol. So these all are using. And lipids and ionic surfactants, twins, spans, SLS, commonly we are using, and bile salts. So all cholates and bile salts we are using for the increasing, for the decreasing of viscoelasticity of the particular formulations. So these formulations are very, very easily goes to the systemic circulation. It will cross the barrier, it will cross the blood-brain barrier, it will avoid the first pass metabolism, and then it will reach as a systemic circulation. And coming to method of preparations, so many methods are there. Here, I will tell you only 3 methods. The first method is the reverse phase evaporation method. So here, simply we can take the protein in the buffer and sodium phosphatidylcholine and bile salt in organic solvent. The organic solvent is need to suitable for the particular drug. The organic solvent always the whenever we can identify it as a pre-formulation studies, the solubility. So what is the solubility of the drug? We can, whenever we can take the solubility, that solubility is in 1 mg per 1 ml. Depends on the solubility, we need to choose as the organic solvent. So these, the sonication and rotaevaporator, the thin film hydration method, and then hot homogenization, it is a best suitable methods for the preparation of bile salts. These are a common method for all novel nanocarriers. All novel nanocarriers, it is a common method for the preparation of any novel carrier, either starting with liposomes to ending with exosomes or invasomes or quantum dots or whatever it may be. These all we need to prefer these type of methods. So I will tell you the formulation and research development. So different type of method procedures, the polymer assisted nanoparticles and nanogels. So these all are the different type of the core shells and polymers and dendrimers and polyplex and micelles and nanogels, and different type of methods are construction of polymer assisted nanoparticles and nanogels. So commonly nowadays, so many people are doing the research in the cancer theranostics for the novel carriers and CNS disorders, novel carriers, and all are majorly the research is going on nowadays in these novel carriers. So what are the characterization techniques in nanocarrier based brain drug delivery? So here the different types of nanocarriers I mentioned: solid emulsifier lipid and liquid lipid and bioactive compounds. So when compared to the solid lipid nanoparticles and nanostructure lipid carriers, what are the characterizations are there? These all characterizations are useful for the biolosomes also. That's why I mentioned that this images also, SLN and NLS, NLCS, nanostructure lipid carriers and solid lipid nanoparticles. The difference of nanocarrier only adding of excipients, only changing of excipients, and some of the times we can enhance the solubility, and then the easily scalability and commercially equipment and small particle size and greater stability and uniformity and low thermal impact and minimal nutritional loss, and these all are not depends on the thermal degradation, high energy consumption not required, and crystallization complexity is not there, and wider size of the distribution not there, and high concentration of the surfactants, co-surfactant, residual solvents. The concentrations are very less. And if you are using the lipid and liquid lipid and bioactive compounds, and these we can take it as the different type of low energy methods, that is microemulsion and spontaneous emulsification and solvent diffusion and solvent injection and phase inversions. The entire novel carrier, we have the different type of characterization techniques. The first one is particle size, the measurement of particle size. So depends on the particle size only, the bioavailability and solubility, we can check it. And polydispersity index, the polydispersity index is below 0.5. And zeta potential, it is whenever we can find out the zeta potential, the surface charge of the molecule plus or minus 30, if plus 30 or minus 30. And then physical stability and thermal properties and solid fat content and crystallinity, polymorphism, morphology, ultra structure and entrapment efficiency and drug loading capacity. The entrapment efficiency and loading capacity, both we can calculate it as how much of the drug is entrapped into the particular excipients and what is the total amount. And morphology, the surface morphology, we can identify three different techniques. One is scanning electron microscopy, and second one is transmission electron microscopy, and third one is atomic force microscopy. The three different morphological structures we can identify. and polymorphism. The crystallinity and polymorphism, always we can check it as solid state concentrations. Solid state characterizations. The solid state characterizations are three different techniques. One is FTIR, and second one is DSC, and third one is XRD, or powdered X-ray diffractogram. So these all parameters are useful for the nanocarriers. So here I will mention the different type of case studies. The process involved in the preparation of novel formulations. Whenever we can prepare the novel formulations, the first we can choose it as the suitable solvent, and screening of surfactant, and screening of stabilizer, and screening of bile salts. These three is mandatory, and same time, whenever we can use it as any method, we can identify what is the temperature of, suppose if you are using as a thin film hydration, what is the basket temperature, and what is the speed RPM. These also influence in critical quality attributes. Whenever we can go for the design, the quality by design, the first we can identify critical quality attributes. So whenever you can choose any process or any method, the first you need to identify what is the critical quality attributes. So then we can evaporation of organic solvent, go for the drug nano suspension, then it will goes the formulation stable. And coming to these all are my case studies. I only done these nano carriers. So this one, it is already published. It is available in online. The dapagliflozin loaded biolosomes for the treatment of hypertension. So biolosomes, it is a drug. It is an anti-diabetic, hypertension drug. The lipids, adjectivators, surfactants, all I am using, and thin film hydration, it is formed as a biolosomes, and then we can optimize the biolosomes and characterization, then in vitro and in vivo studies and pharmacokinetics. So what is the procedure we used? Whenever preparing of these novel carriers, I specifically facing the problem in the laboratory solubility technique. The drug solubility is, and whenever we can use bile salts, or whenever we can use cationic surfactants or anionic surfactants, and then cyclodextrins, then automatically we can enhance the solubility. And coming to second one, naproxen loaded itosomal gel. So this is also mine only. So these all techniques and all novel carriers we prepared in our laboratory, and we are using itosomal gel for the topical application, bilosomes for topical application, and niosomes topical application, bilosomes intranasal drug delivery, spanelastics and topical applications. And then whatever we are preparing as the suspension and emulsions, we can go for the intranasal drug delivery. Alzheimer's. So nowadays, the Alzheimer's, so much of the people are suffering, and pain, so much of people are suffering in a migraine. I am also done the research, the central composite design for the development of carvedilol loaded dermal itosomal hydrogel. And these are the different type of techniques I am using for the itosomes. It is published in 2021 Journal of Nanobiotechnology. And then second case study, I am using dapagliflozin. And third one is, see here, the design and development and optimization of solid lipid nanoparticles of rizatriptan for intranasal delivery. So here, SLNS, we are using anti-migraine for the intranasal drug delivery systems. So these also we can taking as case studies. Thank you for patient listening. You have any queries, you can ask regarding this. Anybody want to ask regarding these intranasal drug delivery and novel carriers, and then characterization techniques of Any novel carrier, you can ask.
Sir,
Yes. Yes, ma'am. Please tell me.
Dear participants, thank you so much, sir, for your valuable information covered on intranasal drug delivery systems, especially targeting to the brain. Now the session is open for interaction with sir. Participants may unmute themselves or type their questions in the chat box. If you have any queries, you can get it clarified with sir.
thank you so much, Professor Anand Kumar Chettupalli, sir, for this enlightening session. Your insights on design and fabrication of novel nanocarriers for brain target via intranasal route for pain management drugs have definitely added great value to our knowledge. Thank you so much, sir.
Thank you, ma'am.
Sir, can I proceed with the closing remarks, sir? Anand, sir?
Yes, yes, ma'am. Yes.
In his scientific talk on design and fabrication of novel carriers for brain targeting via intranasal route for pain management drugs, Dr. Anand Kumar Chettupalli, sir, has highlighted about the significance of intranasal drug delivery systems in comparison to the orally administered conventional dosage forms. And he has significantly demonstrated why intranasal nanocarriers of much significance nowadays. And as it is a direct nose to brain transport via olfactory and trigeminal pathways, bypassing the major barrier, which is triple B, blood-brain barrier. The advantages of intranasal drug delivery system includes like bypassing the major barrier, which is triple B, blood-brain barrier. Direct brain targeting is possible with intranasal drug delivery. And at the same time, there is much scope for enhanced bioavailability of drugs, and there will be a rapid onset of action when it is given by intranasal pathway. And there is definitely improved patient compliance with such drug delivery systems. And nanocarriers for intranasal delivery provide improved drug stability, targeted delivery, and even the controlled release of the drug profiles. There are various opportunities for intranasal formulations because intranasal pathway is non-invasive to transport of drugs to the brain. Sir, in his talk, Sir has highlighted and he has focused on sustained drug delivery can be achieved by using novel dosage forms such as nasal in situ gels as well. Sir has emphasized on the advantages and limitations of intranasal administration of drugs for systemic drug delivery as well. And he has highlighted the challenges of nasal carriers and how to overcome through intranasal drug delivery systems, proper formulating procedures. In situ gelling systems has been extensively explored to target the pain management. Sir has quoted some examples of commercially available marketed formulations as well, marketed intranasal drug delivery systems for CNS disorders as well. And nanocarriers and brain drug delivery, Sir has suggested that there are almost 46 novel carriers that are available so that the drugs can be targeted to the brain through nasal pathways in the form of nanocarriers. Sir has elaborated the classification of nanocarriers as well, and role of nanocarriers in improving drug properties like poor solubility, low bioavailability, enzymatic degradation, rapid clearance, and even poor triple P penetration as well. Sir has quoted the emphasis on pilosomes as novel nanovesicular carriers. They can be prepared by reverse phase evaporation method or homogenization method or even thin film hydration methods. Characterization techniques in nanocarrier based pain detectability has also been highlighted. He's quoted some of the case studies which were done by which were researched by Sir. Thank you so much, sir. for your elaborative inputs, insights on novel carriers, novel nano carriers for brain target via intranasal route for pain management drugs. Thank you so much, sir. You're on.
Thank you, ma'am. Thank you very much.
On behalf of the organizing committee, I extend our heartfelt thanks to Professor Dr. Anupma Chittipalli, sir, for sparing time for from their busy schedule and sharing such an insightful knowledge with us today. And I also thank our respected principal, ma'am, Professor A. Sunita Madam, faculty members, and all other participants from across various institutions for making today's session fruitful. We look forward to seeing you all tomorrow for the 5th day of the Enriching FDP. Until then, thank you everyone and have a great day. Thank you so much, sir, for your valuable inputs provided for us. There is a value addition to our knowledge through your session. Thank you so much for
Thank you.
sparing your. There's a small announcement regarding tomorrow's session. Tomorrow, we have a session at 3 o'clock, which is to be delivered by Dr. T.E.G.K. Modi, sir, Professor and Principal, Kapata College of Pharmacy. Please join, dear participants, all of you, please join on time. That is for the afternoon session at 3 p.m. Thank you, everyone. Thank you, one and all.
Thank you, Anand. Thank you, Anand, for your acceptance.
Thank you, sir. Thank you very much for giving me the opportunity.
So your presentation is excellent, sir.
Yeah, thank you. Thank you so much.
Okay.
Okay, sir. Thank you.
The attendance sheet for today's session will be provided in the WhatsApp group. Please fill the form and submit by today itself. Thank you. Thank you so much. Thank you, one and all. Thank you, sir. We look forward to more sessions in the future from you.